Good morning, good evening, good afternoon, wherever you're watching from. Today in our episodes, we want to talk about something called premarital test. Premarital tests are just tests that you do before you get yourself into a marriage. Marriage is, it's a beautiful thing, but in many instances, people normally focus on the emotion and the love, the chemistry part of it, but you forget about the biology concepts. This is trying to know about your health and the health of your partner. So there are some tests that are very important that if you know earlier, you can prevent a lot of things from occurring in the future. And you can rethink about your decision, and you can also put up some contingency plans about your future. So premarital health should always form part of your plans before you commit yourself into maybe doing a wedding or spending the rest of your life with someone. Remember, this is someone that you are committing yourself to, not only your love and emotion, but even your health will be affected greatly. So you need to do some checkup about your health and the health of your partner before you decide to stay together. So there are quite a number of premarital tests that you can do. We have genetic disorders that you need to check for, and some genetic traits that can lead to certain disorders. We have some infectious diseases that you need to screen in both of you. You need to know your blood groups. You need to know some of the chronic diseases that might be affecting either of your family members that are linked to family history. You need to do a fertility test so that you can be helped and make an informed decision about your future. So beyond all those love and emotions, marriage is a union of two individuals, including their health. So one of the important checkups that you can consider are the genetic disorders. And one of the most common genetic disorders is the sickle cell disease. If you have interacted with the sickle cell disease patient, I know you know what I'm talking about. It is a genetical disorder, and it is transferred from the parents to their children. It is not something that just arises from nowhere. So you need to screen yourself to check whether you have the trait of a sickle cell disease, because if both of you have that trait, then you have 25% chance of having a sickle cell disease, sickle cell child in each and every pregnancy. So you need to screen on that so that you decide whether you want to risk having such a child or not. We have also another genetic disorder called thalassemia, beta thalassemia. So for thalassemia, those who are minor thalassemia normally doesn't exhibit any symptoms. So when two minor thalassemia unite and get married, you also have 25% chance of having a major thalassemia child. And with such children, you will be spending most of your time in hospital doing blood transfusion and seeking for medication. So you need to know and be ready if that is what you want to get yourself into. Another test is the blood group, and for the blood group, especially for the ladies, you need to know whether you are rhesus blood group, if it is negative or positive. If it is positive, okay, you might be safe, but it is negative, at least you will be prepared and prevent complications that might arise during pregnancy, complication that might lead to even losing your child. But if you know earlier, all this can be prevented. So you need to check your blood groups as well. You need also to do a screen for infectious diseases. The most common one is the HIV that most people normally do. But there are also other infectious diseases such as syphilis, gonorrhea. So you might wonder why, because some of these diseases such as syphilis will normally undergo what we call latency, a period where they don't show any symptoms but they are there. So when you screen them, at least you will know and help each other. You'll be able to manage them, you'll be able to protect your partner and protect yourself as well. So we have syphilis, gonorrhea, chlamydia, and the most important one, HIV. You need to screen all those in both of you so that you know how safe you are. And also do a urine analysis to screen for the urinary tract infection, because some UTI are very recurrent and it might affect you and even lead to some complications in the future. But if you know them earlier, you can prevent such competition. Also, you need to check the family history on each one of you. If there is possibility of maybe a cardiovascular problem in the history, a diabetes problem, and maybe things like cancer, neurological disorders. These things, when you know them earlier, you are able to even change your lifestyle to prevent yourself from also getting such problems. So you need to screen for those as well. And finally, you need to do a fertility test. Optional though, but also very important, so that you rule out blame games. You need to check for the female reproductive health. You examine the pelvic. You screen for cervical cancer. You check for the condition of the womb. And also for the male reproductive health, you can do semen analysis. You can screen for things like prostate, so that you at least know the health on each and every individual. And all this will help strengthen your bond together, because you will be understanding that you will be making information from the point of knowledge, and you will prevent a lot of problems in your future. So when you understand how your systems works, you stop guessing, but you start aligning yourself to what you know. So you should consider doing a premarital test before doing all those other plans, wedding ceremonies, dowry, nini. Try to understand the health of your partner. It will save you a lot. It will protect your future generation, will protect your child, will protect the health of your partner, and it help you make sober decision, a decision from the point of knowledge. Thank you very much. Keep following for more and subscribe to my YouTube channel. The link is on the bio.